on. Good afternoon, everyone. My name is Stacy Morris. Again, I'm project coordinator with the Missouri Developmental Disabilities Council. We are super excited to have so many of you join us today. Today, we are hosting another series from our learning series on supported informed employment decisions with Missouri Disability Benefits 101. We're very lucky to have Nicholas Love with us today, who is the Community Inclusion Director at the World's Institute on Disability. I'm going to go ahead and let Nicholas provide any further introduction and go ahead and get started. In the meantime, if you have any questions, please feel free to put them in the chat and I will let Nicholas know, and they'll be answered throughout the presentation or possibly at the end. So everyone's questions will be answered though. So just go ahead and put them in the chat, sit back, relax, and it is all up to you now. Nicholas, go ahead.
Thank you, Stacy. All right, Stacy, please confirm you can see my screen. Great. Okay, so my name is Nicholas Love. As Stacy said, I am the Community Inclusion Director at the World Institute on Disability. The World Institute on Disability, or WID, is the creator of Disability Benefits 101, or DB 101. And so today we're going to talk about how to use Missouri's DB 101 to support the informed employment decisions of the people you serve. So our objective today is we're going to learn how to use this free, easy to use information and tools of Missouri DB 101. There is the email address for, not the email address, the URL for Missouri. That is www.mo.db101.org. And we're going to utilize that to increase employment outcomes. We're going to also have that throughout this presentation. So don't worry about jotting down, and we'll also put it in the chat for you. So we're going to learn how to use Missouri DB 101 to explain SSI and SSDI rules, or what's called work incentives. And we're going to do that to help understand the impact of employment on state and federal benefits. And within DB 101, there are estimators. So we're going to utilize the estimators to explain the impact of earnings on benefits. And we're going to be able to demyth those, debunk. Wow, having a little trouble with my tongue right now. My apologies. We're going to debunk those myths about losing benefits when going to work. And they're just not true. There's just so many myths, and we're going to go through some of those myths. We're going to talk to you about how to get rid of those myths and help people feel more confident with the information. And we're going to be able to motivate and support plans for employment, not just when people tell you they want to go to work, but when people also are telling you they don't want to go to work. So DB 101 is just one tool, has so much information in it though. So Missouri DB 101 is, again, user-friendly, and it's Missouri specific. It's a website available to everyone with internet access. And it's there to help people with disabilities, like myself, help go to work and work through those myths and confusion about Social Security benefits, healthcare, employment, and way more. And again, there's that URL for you.
And Nicholas, we do see you, but I don't know if you're ready to go ahead and put up your presentation now.
I have it up, but apparently it's not showing. So that's just wonderful.
Sorry, I was updating people. Sorry about that.
Why is it not? Okay.
There we go. Now
we have it. Well, hi, everybody. Again, we've gone through the beginning slide and our objectives. We are now finishing with dealing with Missouri DB 101. And again, here's that URL, www.mo.db101.org. All right, so as I was saying, it's a one-stop for all your information, and it's available 24/7. I know you people, providers aren't available 24/7, right? So when people are having stress, when people need information, they need it when they want it. So DB 101 is there 24/7, 365 with that accurate information. And the important thing about DB 101 is there's no need to be an expert or go find the expert. And while each one of you as a provider have your own expertise, you're not going to be an expert in everything. So DB 101's there to help you with understanding those benefits, very confusing and complex benefits. You don't have to be an expert. You don't need to go find an expert. If you are able to enter this webinar, you have all the skills you need. You know how to work internet, click and read. And that's all you skills you really need. So it's really helping you do your job more effectively without learning a new skill set. It's easy to navigate, really easy to find information. It's redundant on purpose, so you don't have to be like, where was that on the website? No, it's all going to be right there for you. And we know one of the main reasons people with benefits do not go to work is fear. People will not even attempt to discuss benefits with anyone, talk about work or anything, because they're fearful that Social Security is going to pull that check if they even think someone is thinking about going to work. And so we want you to know that DB 101 is a safe harbor. It is no private identifying information, and it's not connected to any systems, any government. It is us, people with disabilities, who created this platform. And it's easy to understand how benefit and work programs interact together. And again, those estimators are there, and then the related content that's going to explain that. And I'm going to go into it. I'm going to give you examples and show you demonstrations of these estimators and a little where the information is. There's also short videos, 90 seconds videos in there to explain SSI, SSDI, and that impact on work. So it's very easy to go for people who are perhaps different learners or want something quick, easy to digest. These little animated shorts are really helpful, full of a lot of information. And throughout DB 101, you're going to be able to have access to the local information, specifically what is Missouri's information. So your state, local, and national resources. And again, fear. That is the main reason people do not go to work, is fear. And so we want to empower individuals with disabilities to ease those fears of people with disabilities, their circle supports, and even the service providers. Because I know I was a service provider. That is where I come from, is direct services, doing the exact work you're doing now. And I knew I didn't share all the information I needed to because I was fearful of giving wrong information. Lack of information does not lead to informed decision-making. The only way people can be informed is if they have all the accurate information to make their own choices. And many service providers don't share information about the impact of work on benefits, or they give them wrong information that causes people with disabilities to continue to live in poverty. So we want to empower you as the providers as well. Again, here is the URL. So this presentation on this PowerPoint, I'm going to go over very quickly because I want to go into DB 101 and use the website itself to show it to you. So you received this PowerPoint if you registered for this. And so I'm just going to go through the sections in this PowerPoint. They're all linked back to DB 101. So it kind of comes your little cheat sheet. So there's a section about going to work, getting past those myths, learning about the truth about going to work. We're going to go in and I'm going to show you some of those common myths. And there's going to be a little script for you to read so that you start feeling comfortable sharing that information back. We're going to talk about how to build assets and wealth. And this is something a lot of people don't think about, savings. They think, well, I can't save. I'm living in poverty. I have no money to save. Well, it's actually the people who are living in poverty that need to save. So we're going to talk about ABLE accounts, past plans, trust funds, how to get past those resource limits for people who are on SSI. There's also a section on job supports and accommodations. So learning about the rules and the tools. So how to disclose, should you disclose your disability, and what are the supports and accommodations you can get, and the work incentives. These are those rules that Social Security created to help people go to work. So a lot of people think Social Security doesn't want people to go to work. In fact, in 2000, they created rules to help people, and there are safety nets to help people keep some of their benefits or be able to make more financially good choices. And how about those health cares and keep those? There's also additional information about benefits for young people. So how to apply, important rules for young people, what happens when they turn 18. There's also a section about getting a higher education, which while it is in the young person section, is great for anyone looking for education, how to fund it, where to go to school, how to use those disability resource centers. And for those who have an onset of their disabilities, how do you deal with this new found life of having a disability and what are the resources available? There are two estimators, my apologies, two main estimators in the Missouri DB 101. These estimators allow you to put either actual earnings or estimated earnings to figure out what's the impact on benefits and healthcare. So you go in and you say, this is the job. These are how many hours I'm going to work. This is the wage. These are my benefits. And it'll tell you what's going to happen. Does all the math for you. So there's a benefit and work estimator for people over the age of 18, but not retired, who are on SSI and SSDI. And there's also a school and work estimator for young people under the age of 18 on SSI. There's also two quick estimators where you ask a little less questions. Those are the great ones for motivators. So there's an SSI and an SSDI quick estimator, and they're located in a couple places, and I'll show you that when I go in. This is what they look like. This is the main place you can find it. We have a table of contents. It'll be an SSI and work or SSDI work. Because the question is, what's going to happen to my SSI if I go to work? The quick estimator will let you know. Again, these are the estimators. I give you a little bit more information. It involves not just your SSI or SSDI, but you also can put in information about housing, SNAP, or other cash benefits people can get. You also can even go deeper and you could do budgeting and ask questions about what is the cost of going to work. So there's a section about impairment-related work expenses, which is what people pay out of their pocket to go to work due to their disability. But there's also expenses people pay out of their pocket to go to work that are not related to their disability that everyone has. Maybe the sample I'm going to tell you is about going to work at Target. And if you go to work at Target, you're going to need a bunch of red shirts. Well, that's not an impairment-related work expense, but it is an expense. And there's also the expense of maybe food if you're working 40 hours or transportation. So you can go in and get those, get that information and results. In the school and work estimator, we talk about your plan, the monthly income changes, and there's next steps to help you go through. Again, there's videos throughout. There's a video tab, but there's videos embedded in the proper places when you go in. So there's videos on what is SSI, so understanding SSI, or understand what's going to happen to SSI you go to work, and what about SSI and young people who go to work. There's also ones on SSDI. So what is SSDI? What is SSDI in planning for work? And this one here shows some of the safety nets that allow people to keep their benefits and restart their SSDI if they need to, without having to reapply. And then understanding how those rules for SSDI actually work. Okay, so I'm going to get out of this for a minute and I'm going to go right into Missouri DB 101. Now, this is your Missouri DB 101. It is easy to understand. It is clean, but I'm going to tell you, it will be changing in a couple months. And we're actually going to make some improvements. All the same information's there. It's going to still be easy to find everything. It's going to look a little different, be fully mobile responsive, a little bit more intuitive on the navigation. It'll also have a couple extra little tools and resources that will be added to it. That is all thanks to the Missouri DD Planning Council who are paying for those changes. So thank them for that. So we have at the top here's our homepage. We have estimators, videos, and a glossary. There's a search here. So you can simply just type in what you're looking for and find it. Here are the sections that I talked to you about. Going to work, getting past those myths, building those assets and wealth, job supports, work incentives. We have then the young people, benefits for young people, higher education, that disability onset, going back up a little bit here. And the programs we're covering are SSDI, Supplemental Security Income, which supplements income people don't have for food and shelter. So it's people with low or no work history, or SSDI, Social Security Disability Insurance, which is exactly that. It's social insurance. And when people pay their FICA on their paycheck, that's your premium for your SSDI. So that's for people who, for their social insurance for when they retire or if they become fully disabled prior to. There's also a tool for finding the right healthcare coverage for you. That's also right here. Easy to find interactive guide. I'll show that. And then we have how to explain those benefits. So what about those benefits, how they work? And again, those two estimators. So there's a benefit and work estimator as well as a school and work estimator. So I'm going to go to the benefit and work estimator. Again, it tells you who it's for. What do you need? It talks about gathering your bank statements and your information. You just need to make sure you have accurate information. If you have accurate information, you're going to get accurate information back. It'll take about 20 to 30 minutes to go through it with an individual if you go through the full reading every process of it. I will let you know, though, it takes considerably less if you do it this way. And I think this is the most effective way. I'll be very honest with you. Most people do not care about benefits. They care about three things. One, will I be better off? Two, how much money will I have? And three, what's happened in my healthcare? If you can answer those three questions, then you can help people make informed decisions about going to work. So I recommend going through the full estimator with somebody and then going back and talking about those special rules that help people go to work. Will all the information be kept private? Yes, there is no private identifying information in here. And it's, again, not shared with anybody. And again, these are only estimators, right? Now, there is a recent update because we know there has been changes to your Health Net adult expansion group, your Medicaid expansion. You can get more information right here, clicking there. So DB 101 is accurate information. We pay very close attention to the rules happening in Missouri. We work very closely with our clients in Missouri to be able to make sure this is accurate information. And you can see when this was last updated, and you will see throughout there's updates. In the corner here, we have all the rules and programs that are covered on the estimator. So we cover SSI, SSDI, childhood disability benefits, supplemental aid for the blind, blind pension, SNAP, also known as food stamps. We could talk about housing and earned income disregard, your Missouri Health Net, your Health Net ticket to work, a health assurance program, and your Medicare, employer-sponsored health care, individual health care, and earned income tax credits. So we recommend that this is not DB 101. We have a little disclaimer. It's not about replacing benefit specialists. Missouri has benefit specialists. Unfortunately, in the whole entire country, there are not enough. So this is to help people get the information they need to either move towards a benefit specialist, or perhaps they get all the information and they don't need it. It helps you as providers do the job more effectively because you're not reliant. If somebody says, I'm going to get a raise and they want to know what's going to happen to their benefits, they don't have time to wait to get connected to a benefit counselor, right? They need that answer now. And you can go into DB1 and get that answer. So individuals can do it themselves, or you as providers can work them through it. So simply ask simple questions. It's very easy to navigate through. Sorry, hit the wrong button. My apologies. Ask a couple questions. It does ask for the month and year, simply to know how close somebody is to age 22, because there's different rules if somebody's under the age of 22, receiving SSI, or if they're close to retirement. We ask about their disability determination and if they're blind. Blind is the only disability to have special rules. Throughout, there are little tips in the gray sections. Again, if you read all of these up front, it takes some time, or you can wait till the end and cover them. So you answer a couple questions, very easy. And at the end, you get this kind of result. And it says in this plan, you're better off. First things answered. Bottom line, you're going to have more monthly income. It might go up and down over time, but it's there, right? How much more money? We have this graph here, and it's able to show this purple line with the same amount of money. They're not going to work. What happens is go to the work and we have a couple step downs. And these step downs are when different rules start applying. So what I did is this is someone who has receives SSI and SSDI, receives food stamps, and has had housing. So I put all of that in there. And we're able to show, and I'll come back here, how much money they have. So right now they get $901, including all their benefits. In 6 months, they'll earning where they're in what's called the extended period of eligibility. And I'll show you how I know that. They're going to earn over $1,000 more a month. And when they are done with their extended period of eligibility, when they're done with their trial work period, they will be losing their SSI, their SSDI, and their food stamps. But if you told someone you're just going to lose all your benefits, they're not going to go to work. With this, you're able to tell them, even if you lose your SSI, your SSDI, and your food stamps, you are still first eligible for all those, which means you can get them back without reapplying. And you're still going to have over $500 more a month. And so that's how much, second question, how much money, right? And you will be keeping your health care. Third question answered. So we're able to show that by going to work, I have this person going to work at Target. It's one of my favorite places to go, earning, let me see, I remember $13.50, I think, because Target pays a couple dollars more than minimum wage in each state. And so going to work full time at Target, they will have, they had their health care, their Medicare, and their non-spend down Missouri Health Net or their Medicaid. Going to work, though, they're also going to be able to get private healthcare through the employer through Target, which has really good insurance. And therefore, they're actually increased. They are able to have their Medicare, their Medicaid, and employer-sponsored healthcare. So they have 3 healthcare options now, right? And we know it goes down through, first your employer, then your Medicare, Medicaid, Medicare, and then your Medicaid. We are able to give some people some information on the side to help you understand that it goes to 0. Your rent may increase. I'm going to show you all this in a minute because, again, we're talking about HUD housing, but we're also talking about earned income disregard. And we give some information about what's called 1619B, which means just because your SSI check went to 0 doesn't mean you're no longer eligible. You still be able to maintain your health care. It talks about the resource limit. We're also going to tell you how to get around resource limits. We talk about why did your SSI, SSDI go to 0? It's because you're working over what's called substantial gainful activity. You can click there and get the definitions and all the information about earned income disregard. All of that stuff is right there. So at the top,
Nicholas?
This is how you, yes, go ahead.
Pardon me. And did I just want to be clear on something you pointed out that I think is really important. When you first started the session, you showed you just need to put in the month and the birthday, and that's what helps keep it, keep the information private. Is that correct?
No, the information, all information is private. What that does is it helps the estimator understand if somebody's close to 22 or close to retirement. If it's close to retirement, say somebody is a couple of years from retirement, it's then going to estimate in, and now you're going to go talk to Social Security about retirement. If you're under the age of 22 and receiving SSI, which this person is receiving SSI, but they're well above 22 because I put my birth date in, well above. If somebody's under the age of 22 and in school half-time receiving SSI, they can earn a lot of money, which I can't remember the number right now, and not lose a penny of their SSI. So I think it's $1,840, $1,880 maybe. I'll be able to check in one moment with DB 101. That's what it is.
Oh, and I guess what I had heard were some providers are concerned about the identifying information being in a system like this about security reasons. And so I was just trying to point out that because we're only asking for the month and the year, we're not asking for social security number. You're not putting in the full birthday. You're not putting in a name.
No.
Those are some of the things, because I think we really need to be aware of the cybersecurity. So that's kind of what I was trying to
Yes.
point out.
So
Excuse me.
again, this is a very secure site as well. And we work very hard with that aspect. But I know that there's some people who don't want to put in a month and a year. Then if they're not near 22 and they're not near retirement, I put in my own birth date, right? You just put a date in. It just makes it be able to know. But if they're closer to those ages, you do want to put that in because you want to know when there's going to be activity change. So that's where that information comes from. There's also ability to put a zip code in. If you don't want to put the zip code in, don't put the zip code in. And there is no identifying information. If I receive $500 in SSDI and for this person that I put in for them, $500 for SSDI and $361 for SSI, that doesn't tell me who anybody is. So there is no identifying information whatsoever in this. So it's completely safe, which is why we created it this way. We don't want to have any identifying information. We don't want people to feel uncomfortable sharing that information because people will not even open Social Security letters. People will not even talk to an employment specialist because they're afraid Social Security is going to hear about it if they go to vocational rehab and they're going to pull their check. These are not true. So that is how it works. Across the summary, thank you, Stacy. Across the top, we have summary. We can recap the plan. You can look at what I did. But the timeline and the monthly, healthcare tips, next steps. I'm going to go to the timeline because that's how you explain. You don't know why these things are stepping down. It looks scary to people, which is why in the new design, it looks a little different. And my computer just went and did something totally different. Well, that's just fabulous. So you could go through the timeline as I'm getting my computer not to be a pain in my bottom. Let me go back in. This is the plan I was just in, saved for me.
That's great to see that you can have the saved sessions though. So actually you were just showing us another feature.
Yes. Go to the timeline. And I think my problem is I have so many windows open to make sure this works for you. You go through every major change. So it will be able to tell the person, this person had a couple trial work periods already. We're able to tell what their income is when they start working. We're able to tell them they've gone through their 6th, 7th, 8th, and 9th trial work period, which means they've entered their extended period eligibility. I have no clue what that means. Click the button and it explains how that's 3-year period where if your wages go up or above substantial gainful activity, which is 1,350 this year, if you are not blind. If it goes above that, the person doesn't receive their check during that period. If it goes below, they get their check. It goes back and forth, not needing to reply, simply reporting. It then actually goes into a grace period where it's 3 months with a check. Again, I can click there and get that information. I'm able to see what happens when the check, SSDI check goes to 0, and their monthly income is now $2,349. They started with $901. And we're able to even talk about earned income disregard, which says because they're receiving HUD, they were paying, I think I said I was paying $300 a month for a HUD, and then $430, I can't remember quite right now, for the housing, but it's able to say that first year the rent will not go up. So, right after that, oh, there we go. Those are how much the amounts were. After that, it counts half, and then after that, it counts the full 2 years. After that, it will count. So it even tells you what your rent will be. So very simple. Again, when I talked about all the stuff you could read, they're right there in the tips. That's all the rules, information you can share once they now have those 3 answers, right? So we talk about how to report. We talk about the trial work period, avoiding overpayment related to healthcare, all of it's in there, and you can click in and get more information. I'm going to get out of that session. There's also the school and work estimator. The school and work estimator is for people who are under the age of 18 receiving SSI. And you go through and you answer even less questions, same thing. It's no identifying information. It takes 10 to 15 minutes. Make sure you have accurate information. You answer very few questions. And you will end up with this as your results. Bottom line, right? Work pays. You're better off. Your healthcare will continue to have more monthly income. Now, this is a young person who is 16, who is going to go to work for 10 hours at minimum wage. This is just a school program learning how to be part of our workforce. And the sooner people learn how to be part of the workforce, the more they're willing and able to engage in that workforce. But we know that if this family is receiving $250 of SSI, it's because the family has very low resources, which means this family is living in poverty. And the family may be very frightened about losing that $250 because that $250 is paying for food and shelter, not only for this child, but probably for siblings in the family as well. So the family is fearful of losing that benefit. Family is fearful of losing that healthcare because the child has significant disabilities and has a lot of healthcare needs. So we're able to do some very simple questions, and we're able to show in this plan, you're better off. Healthcare coverage continues and you have more monthly income. That is all a parent wants to really know. And we're able to tell them that work pays, that they're going to be able to continue with the Missouri Health Net without a spin down, and that they will have $485.03 more a month. So we're able to show with this graph, which is very similar to how the graph will appear in the benefit work estimator in the new redesign that's coming out in several months. So we're able to say 250 now, unearned income. Here's how much they're earning, $485.03. But what happens to our healthcare? Nothing, not a penny was lost. They still have 250, which means this child who was receiving $250 now has $735. So this family that was fearful of losing 250 now has 735. And we're able to say here, this is because of student earned income exclusion, which, here's my number that I couldn't remember, says that, move it over. Oh, my goodness, I forgot how much it went up this year. It went up significantly this year. You get $2,040. A child can make $2,040 a month without losing one penny. There is an annual cap of $8,230. And after that, it is simple, what's called a 2-for-1 reduction. Now, I'm going to tell you something about 2-for-1 reductions. Don't say the word reduction to people who don't have money. For every $2 they earn, they get to keep $1 of their check. Every $2 earned, you get to keep one. I've used 2 positive words, earn and keep. That will engage people. We'll also be able to explain to them about impairment related work expenses. And by going to work on SSI, you're paying into your SSDI trust through that FICA. You're paying into your social insurance, which means they could actually probably qualify for SSDI in the future. And once they turn 18, they're no longer considered the parent's resources and income, but their own. You can also save these sessions, email them with consent, print them out, put them in charts, right? They're there. It's very helpful. You can then use as coordination of care. You can email it to the vocational rehab counselor if you're working as a provider. So we show the difference between these 2 plans here. You can change plan, add a plan. Very, very helpful. Those are 2 of the estimators. I'm back on our homepage. So those estimators are really, really helpful to understand. And all you have to do is click and read. So back on our homepage, I want to take you through a little bit of DB 101. So we have getting past the myths. Now we have 7 of the most common myths. I can't work. If I work, I lose my benefits. If I work, I'll lose my health care. If I work, I'll lose my disability status. Can't find work, can't afford to go to work. And if my benefit stops, I'm never going to get them back again. All of those are false. And we can go through. DB1 starts always with basic information, and then we progress down. So people don't have to take all the information in. They can use the information as they choose. So let's go as an example of, if I work, I'll lose my health benefits. That is a huge issue for people, and it should be. So it's, if I work, I'll lose my health care. And we have a little box here that explains common things somebody might say. Something like, they have ongoing health care needs that I would never be able to pay for myself. And people tell me I shouldn't work. A lot of people tell people they shouldn't work. Not really employment first there. Everyone should be able to go work. But people are telling this person they shouldn't work because they might not be able to see their doctor or get the health care they need. Now, if you're not comfortable sharing information about benefits, I love this because the next paragraph is a script. And you can simply say, read it. Losing your healthcare benefits can be a huge concern. And if you're thinking about going to work, however, several programs can help you keep your healthcare benefits when you go to work. Some jobs will offer employer-sponsored healthcare benefits, but for some that may not be enough. For some, they may want to keep their Medicare or the Missouri Healthcare Net benefits. And then we go into explaining how to keep those health cares. Here's about Medicare and the rules about Medicare. What happens when your Medicare go to work? Extended Medicare, Missouri Health Net. What happens, right? It talks about the modified adjusted gross income, or the MIG, of 138% of the federal poverty, right? So we talk about how people qualify. We talk about how they can do a spend down, how the 1619B rules work, and how they can even use the Ticket to Work program. How to apply for it, spend down, a little bit more in detail. Again, everything goes more in detail. What about using public or private healthcare? This is just short, because what you can then go is you can go into finding more information, right? So it's short and condensed. You don't have to go through everything with people. So you can go through these myths with people. You can find about, I'm going to lose my disability status. You go to work, Social Security is going to decide I'm not disabled anymore. Because a friend of mine started working and Social Security decided. Everybody has a friend who got in problems with Social Security. And he explains how that's not true. So those myths are really, really helpful for that. Building your assets, again, very important. So why is it important? But we also go into then several programs like the ABLE account, Achieving a Better Life Experience, where people can save up to $100,000 tax-free and not have it affect any of their benefits. And so we talk about an ABLE account. We talk about how to open an account, how to know if your disability qualifies. If you receive SSI or SSDI, they do. You also can self-disclose and self-certify. How to compare in different programs in different states, different rules in different programs, how to deposit the money, examples, all of that's in there. How to set up what you can spend it on, and how even an ABLE account and a special needs trust can go together. Very important, highly underused life program. We also talk about maybe other programs like a PASS plan, where people can set aside money who are receiving SSI. People can set aside money for a job goal. So maybe they can use it to help pay for school or training, or even start their own business or get assisted technology. So how to set it up, the eligibility process, the application. Every time we talk about something, we have the applications there. So the application's right there, right? All of it's there. Very easy to do. Anyone can help with that. We also have information on trust funds. I'm going to move on though as we move further. We talk about job supports and accommodations. So we talk about the Americans with Disabilities Act and explain the rules. What about disclosing that disability? Do you have to? No. How do you though if you need reasonable accommodations? What are reasonable accommodations? And requesting them. We have an interactive process that not only explains how to ask for them, but it even gives you sample letters to request reasonable accommodations, common questions that people ask, and common types of accommodations. And so we can talk about different types of accommodations people need. What if people are needing assisted technology? Where can you try out assisted technology in Missouri? Well, here's your Missouri Assisted Technology Advisory Council, right? You can go to the Missouri Job Centers. You can go to independent living centers, highly underutilized. Know your independent living centers. They are information referrals, one of their core things. They can help with a lot. They can help with advocacy as well as helping with independent living skills, how to fund assisted technology. Here are all the ways in Missouri you can fund assisted technology. So really, really helpful. What if you need a personal assistance, right? How to get and utilize and fund a workplace personal assistance. There's also next steps. Each one of these table contents have next steps, which are really great because it has like all the little resources in one place. So you can go to the Job Accommodation Network that learns about common accommodations and say, this is a disability. So say somebody is on the autism spectrum. They can go and see what are common accommodations for people on the spectrum. And then they figure out what are they paying out of their pocket. And if they're paying out of their pocket, it could be an impairment aid work expense, which means Social Security wouldn't consider part of their income as actually income. So they can pay for this. So a lot of great resources, learning about the independent living centers, learning about the ADA. You got here your Great Plains ADA Center, your Missouri Protection and Advocacy, Ticket to Work, and here are all your benefit planners. So again, this isn't to replace benefit planners. You can go to your benefit planners and get that information. Maybe you're helping somebody get there. I'm going to let you know. I used to manage the whole entire benefit planning for the state of Arizona. People don't go to benefit planners if they don't think they can go to work. It takes providers to share them the information like we have on DB 101 to get them motivated to go to work and then go to work. We have work incentives. This is a pared down approach to the SSDI and the SII work incentive, the rules that help, the healthcare work incentives, the affordable housing. So you can go in and learn a little bit about trial work periods, substantial gainful activity. Again, Ken's down. You also have your programs for young people, so you can learn why benefits matter, key programs, all the things that deal with younger people, higher education, including different types of education, the application process, and funding. So how to fill an application out, how to fill out grants, how to use Pell Grants. And then we have an article on sudden onsets of disability, so when somebody's getting new. Then our programs like SSI and SSDI are set up the same way. How to apply for it. So here's for SSI. Here's the number. Here's your local Social Security offices for Missouri. And there's even a cheat sheet. This is the reason why most people are declined. They don't have all the paperwork they need. So here's all the paperwork they need. Checklist. You can print it out. And while you're waiting for it to be reviewed, what other things should you be looking at? We're able to talk about the disability determination itself. How does somebody, Social Security, determine someone has a disability? So there are the 5 steps with examples to go through to help people understand the application process. And then when I talk about the SSI and SSI work, here's that information. So, right, talks about how your income isn't going to go down as much. Your benefits are not going to go down as much as your income goes up. Here's that quick estimator I talked about. You can go in and ask just a couple questions. Very simple. Let's say somebody gets the full benefit amount of 481. I'm going to tell you how fast you can do this. Somebody's telling you they can't go to work. And you're like, okay, you're listening to their story. You got your computer open. You put in a minimum wage in Missouri of $11.15. They're telling you they can't go to work because they'll lose all their benefits. You say, okay, you put in minimum wage, part-time, use these earnings, show those results. Oh, look how fast that popped up. And what I'm able to show this person is if you went to work, again, this is just a foundation, part-time minimum wage, you right now get $8.41. Go to work part-time, you will have $1,668. Here's your income. You're gonna have 970. Your check will be reduced for every $2 you keep. For every $2 you earn, you get to keep one of your check. It'll be $398, which means you have $527 more. So what you do, instead of arguing with them when they tell you they can't go to work because they're going to lose all their benefits, ask them what they don't like in their life. Ask them about their housing situation. Ask them about their food. Ask them about their entertainment. Hey, did you see that thing on Netflix? No, because I can't afford Netflix. Would you like Netflix? That'd be awesome, right? Ask them, what would you do with an additional $527 a month? And when they start telling you how their life would change with an additional 527, let me show you how that can happen. You could go to work part-time, minimum wage, and you will have $527 more. And now you can encourage them to go to work and go into the estimator and go a more detailed program. That is why I love this tool. It gets rid of those mints. Here's all the rules. Here's all of the impairment aid, work expenses, student earned income, ABLE accounts. Again, short information, but if I want to know more, I click and I'm right back to that ABLE account that we talked about earlier.
Nicholas, we have a
Yes.
question in the chat, if
Yes.
I may interrupt real quick here.
Yes.
We have a person whose son is receiving SSI and SNAP benefits,
Mhm.
and they're in another state right now. So when this person moves to Missouri, the question is, would he be able to transfer his benefits to Missouri? Or does he have to reapply to get benefits? And maybe that's too specific of a question, but if we can generalize that, that would be great.
We can generalize it because you will be able to transfer your benefits, but what benefits are received might change because depending on the living situation he has in Missouri. So if he's living independently in another state and then say moves home with mom, mama's help paying for food and shelter, and therefore his SSI check could be reduced. His Medicaid will be different because Medicaid is state specific. So I can't tell you what Medicaid benefits he would receive. I can tell you though, mom, how to get around that challenge with maybe somebody's helping with food and shelter. Open an ABLE account, put that money into the ABLE account. Don't pay their rent. Put the rent money in the ABLE account. It's now not a resource. So there's tricks around getting around stuff. Let me get back to the SSI. At the bottom of the SSI, there are the embedded videos about Medicaid and young people. So the videos are embedded in the right areas for them. We always have examples, frequently asked questions, and pitfalls even. So we know what to avoid. And the next steps will be able to take you through even some of that information that was in it. Like here's how to apply again. Here is your Missouri Protection and Advocacy Services. Here's your SSI experts for Missouri. And here are your benefit planners. So that information is duplicate throughout on purpose, so you don't have to go searching for it. Same thing happens with SSDI, set up exactly the same way. And finding the right healthcare coverage for you, which is also over here. It's a great interactive tool. I've set it up for a family who has $35,000 a year, 3 people in their family, and their resources are under $530, $5,300. Having problems with numbers today. My apologies. And I think it's because we're recording. I always mess up when I record. And we're saying it's a 3-generation family, 3 people in the family. There's a child in the family. Grandma's receiving Medicare. The daughter has a disability. Grandma's over 65. You see my options. These are the options for this healthcare for this family. You can use this even if somebody doesn't have a disability. And I can hover over and it tells me exactly how much it is for the Health Net for Kids, which is for low income children, for a household of 3. I went up here and I said, well, okay, now cousin moved in. It's a household of 4 now. And I went back to the exact same place and now it's a household of 4. It explains what it is. It has more details here. say I want to know more about the Medicare program, I click on it, and now I'm in the how health benefits work, which is actually the next article that I was going to go to. So this is all about healthcare. So we can learn about income-based. We can also learn about disability-based. We can learn about the ticket to work, Medicare, which is where we are now, employer-sponsored or individual healthcare. So I can go in and learn about it right there. I can go to my next steps and get kind of a short little detail of it. So I'm going to go to the home, and I'm going to go across the top here to show you. Again, the estimators, there's there as well as they were right here. All those videos are embedded. If you just want to check the videos out, go to the video tab. Here's all the videos that I was showing you on the PowerPoint. Quick, simple, like about 90-second videos that explain a lot of information. Again, these were paid by the Missouri DD Planning Council. And then there's a glossary. So, people talking acronyms, Social Security's horrible about it, right? We can explain all that. And throughout DB 101, anything that people need to explain, what are low income resources, it'll take you to that information. So you can learn what is accountable income. All of that's going to be covered. You don't have to remember all of this. And if you don't know something, awesome. Go to DB 101. Like I couldn't remember how much it was for student earned income exclusion. So I'm just like, just go to students, benefits, and just learn about those programs. And they'll help you right there. So we have about 5 minutes left. I want to make sure people have opportunities to ask questions. So if you have not asked a question, please put it so in the chat. And as we're waiting for people to feverishly write a question, I just want you to know that this tool is available to absolutely anyone with internet access, right? So it's a great tool. I work for the World Institute on Disability. I started in Arizona 12 years ago. We got DB 101 as a service provider. I've used this tool so much and it's been so helpful, and I've seen the results, and I've worked really hard. I've become very passionate about this tool because I know it changes people's lives. I know it gets the information that providers are not trained on. And I know it answers and addresses that gap in services of that much needed information so people can have informed choices. And that is not why I work at the World Institute. So I'm not selling you on this. You already own it. I don't have to sell you. What I'm telling you is people with disabilities, no matter how significant we have, can go to work. And this is going to help you get those informed information out. So you can feel a lot more intelligent and efficient with your job than you've been given resources to do. You have DB 101. Use it. It is an awesome tool. Stacy, do we have questions?
Yes, we do. And the question is, are there, oh wait, hang on a second. Are the trained benefit specialists referred to through Social Security or through a private agency? Maybe they're speaking of that disclaimer that we saw.
So Social Security pays for a program called WIPA, which is Work Incentive Planning and Assistance. So Missouri does have benefit counselors. They are not connected to Social Security because bless their heart, Social Security does not train Social Security people on work incentives. Do not rely on them. You will get wrong information. We work with national experts. We are national experts. I am a benefit counselor myself. Those people are trained and certified, but not part of Social Security. So they can give non-biased information. As we're finishing up some of the questions, I know Stacy has a poll. Is there any other questions, Stacy, while you're getting your poll up?
I do not see any questions, but it would be so wonderful if we had 100% of our participants answer the poll. So please do so, just two quick questions. Have you used DB 101 before? And do you plan to try DB 101? And I'm so excited. Oh my gosh, already 29, 100%, 35, 100% are saying they want to try DB 101. That is wonderful. That makes me so
That
happy.
makes me so happy because my whole entire career for 22 years has been about competitive and great employment for people with disabilities. And I know this tool is going to help you. And I feel for people who are trying so hard to do their job as effectively as they can and make sure people have the right information, because bad information, partial information, and no information are all the same, not informed. So
Well, and Nicholas, there's so much information that we're expecting the benefit counselors to know and understand, and a lot of hard terminology there. So that's great that you break it down for the kind of for both audiences on the website, where the videos can be helpful for the individuals looking for work as well as for the benefit counselors. We do have a couple questions. One is, how would we be able to contact you? And I think they want to contact you, Nicholas, not me. So
So I do not do any direct services. So please do not contact me. That is on purpose. Sorry. I'm a policy person now. My job is to teach policy and change the world. And I'm trying to do that one at a time. What you can do though is, Stacy, can they contact you so we can talk about additional training opportunities?
absolutely, yes, because that was the other question was, or comment was, great information. I would love a longer webinar about this. And one of the people also mentioned that unfortunately that they've been misinformed by Social Security Administration. They had to prove them wrong with their own website. So that is unfortunate when
So
that
what
happens.
what I can tell you is Social Security, again, is not trained. They do not train people on this. So I have used DB 101 to help educate Social Security on what my rights are and what we need. So if somebody says you can take a DB 101 printout and they explain to me why this isn't accurate, and they won't be able to, right? I've had parents who have been able to get information and get money back, right? We've used it to help people with redetermination. What I recommend is that people play with DB 101. Go in, you can't break it, play with it. That's how I learned. Set aside, you guys set aside an hour today, set aside 30 minutes every once a month and go in and practice, right? Just make up things, play with it. You'll love it. Now, for additional trainings, I can tell you I will be live in Missouri for the Behavioral Health Conference, your mental health conference that is happening on the 8th of September. I will be presenting on DB 101 there. So if you're in the behavioral health world or want to go to the behavioral health conference, I'll be there. We also will be doing another presentation next Monday with the Missouri DD Planning Council. There is another presentation specifically for people, and because we want people to know that you now have information about DB 101 providers, and now we want the people informed, because I think it works together. So we're going to be doing a presentation on how to make informed decisions using DB 101. Very similar, slightly different discussion. And if you do want trainings with me to give something for your organization, please do contact your Missouri DD Planning Council. They'll get a hold of me and we can discuss additional training opportunities.
That's a great point. I'm glad you pointed that out, Nicholas, that you are available if there is an organization that would like those trainings. We do have someone who said, as a person with a disability and a vocational rehab counselor, wanted to thank you for this informative information. And we had someone offered several $1,000s to participate in a medical study, and we're concerned about losing benefits since it was short-term source of income and not a job that would continue. That's interesting.
So again, ABLE accounts. If you put money into an ABLE account, it's not resource. Now, income, they might have a short time where they're going to be above that SSI. If it's for SSI, that's a means tested, which means financial need. But then the next month, those resources would be down again. So they could take that money, put it in an ABLE account, no longer a resource, and the next month it'll come back. So there's ways around rules. Learn the rules, because if you learn the rules, you can get around them. All right, we are at the top
Wonderful.
of an hour. I appreciate everyone today. Please use this tool. Missouri pays a lot of money to make sure you have the information. So make sure the people you serve have the information. Thank you.
Thank you so much, Nicholas, and thank you so much to all of our participants. I really appreciate the good questions and everyone being on time. I hope that you have a wonderful rest of your day, and please let others know about next week if you know of self-advocates who you think DB 101 would be helpful for them to go through. Thank you all. You're getting lots of thank yous and great jobs, Nicholas, in the chat.
Wonderful. I appreciate it.
All right, we're going to close off. Have a wonderful night, everyone. Go check out DB 101. Thank you.
Do you want me to stop recording?